Welcome back to the Skinfluence Podcast. I'm your host, Dr. Dustin Portela, board-certified dermatologist, and I'm joined as always by my co-host, Austin.
Hi, I'm Austin. I'm a physician assistant here at Dr. Portela's practice, and we're going to dive into retinoids.
Retinoids 101.
Yeah.
So it's probably, after sunscreen, the most common thing that I recommend online and in the clinic to help improve somebody's skin.
Yeah, I'm the same way. It's probably one of the top things that I recommend to my patients. Not just for medical, like acne, things like that, but for cosmetic reasons as well.
Anti-aging. We're going to get into all the different benefits that retinoids can provide, how to use them safely, how to pick the right one. So I think the first thing that we should talk about is, what are retinoids?
Yeah. So retinoids are, or retinoic acids, they're derivatives of vitamin A. Mm-hmm. And what they're trying to do is normalize your cell turnover rate, increase the cell turnover rate, but while they're doing that, they're allowing the skin to mature properly as it should. Mm-hmm. As the skin cells develop, they'll develop properly, they'll adhere properly, and then they'll fall apart properly as they should.
So our skin has a normal process that it should go through, and then under inflammation or external stressors, pollutions, toxins, free radicals, the maturation process, the development process of our skin can become disrupted, and it can lead to acne, dullness, pigmentation, fine lines, wrinkles, all of these things. And so retinols in a modern world help to prevent and overcome some of the challenges that our skin is faced to on a daily basis.
Totally, to help delay some of the aging process as well.
Yeah. When we hear the term retinoid, retinoid is often thought as being the prescription, whereas retinol is thought as being like the over-the-counter option.
Yeah.
And just because we use them commonly that way, it doesn't necessarily mean that's how they really are classified.
Totally.
Everything is a retinol, and then there's just different variations of that. They go through chemical changes, whether that chemical change happens in a laboratory and then it's packaged up, or whether it happens inside your skin. Everything has to become retinoic acid in the skin before it is able to do anything.
Yes,
so
before it's active.
Strictly over-the-counter retinol is not an active form that is going to make changes in your skin. It has to go through enzymes in your skin like aldehyde dehydrogenase, and there's several steps where retinol will be converted to retinaldehyde and then to retinoic acid. And retinoic acid can then go inside your cells, and it must go into the nucleus of the cells and bind to something called the retinoic acid receptor, or RAR. There's several different types of retinoic acid receptor subtypes. There's like alpha, beta, gamma. And once they bind to that, they can cause the nucleus and the DNA transcribing and machinery to basically start making the proteins to induce the changes that we want to see from retinoids. The retinoic acid receptor is in a family of receptors that is highly important in the development of a fetus. And we'll get into why that's important when we talk about some other things in the episode. But essentially, the prescription tretinoin, which is the most commonly prescribed retinoid by dermatologists, is retinoic acid. We just call it tretinoin.
That's correct. It is the active form that you're applying to your face. It doesn't need to go through a process where it becomes retinoic acid.
But when you're buying something over the counter, usually you're going to be buying a retinol version that has to undergo that conversion. And some companies do make retinaldehyde, which has already gone through one step of conversion. And the reason that the prescriptions are often more effective is because every time you have to go through a conversion in the skin, you're losing a percentage of the molecule. Not everything is being efficiently converted and getting into that active form.
Totally.
So using retinoic acid, prescription tretinoin, gives you the active form, and that's why we see more benefits from it, but we also can see more side effects from it.
Totally. And then on top of that, there's adapalene. So we have retinols, and then retinaldehydes, or also known as retinols, with the AL at the end. And then tretinoin we prescribe, and then adapalene. How does adapalene differ from the others?
So adapalene and also things like tazarotene and trifarotene are considered synthetic retinoids, and they were basically formulated in a lab through scientific research, found that they could create these chemicals that had similar binding sites or similar mechanisms as retinoic acid. So they are active. They are able to get into the cells and bind to the retinoic acid receptors, whereas I think like trifarotene binds only to the retinoic acid gamma receptor. And they've just created these, and these are prescription versions, with the exception now of adapalene. Adapalene used to be by prescription only because it is an active retinoid. But maybe 4 or 5 years ago, it became over-the-counter. And when I am recommending to people to do an acne routine and just use over-the-counter products, usually I am recommending that they purchase adapalene. The two main brands that make that are going to be Differin, which was the prescription
That
name.
was the prescription, yeah.
And then La Roche-Posay makes an adapalene, the Effaclar adapalene. And then I think there's Acne Free is another brand that also uses adapalene.
I haven't heard of that one.
But my understanding from some insider information I was given, and it may be different now, is that there's only one company that makes adapalene and then sells it to all the other companies that put it in their product.
That sounds
so it's all the same stuff. It's just different vehicles, what works best with your skin.
Yeah. Awesome. Well, we discussed a little bit how retinols and retinoids work. There's some side effects that come along with that, especially with the prescription strength tretinoin, the active form already. A lot of the time we'll see flakiness, dryness that happens with these medications. And even with the over-the-counter ones, you may see some mild flaking and mild dryness. And then you sunburn easier as well. Those are kind of the main things that I talk about with my patients. Are there any other side effects that you noticed?
Those are the main ones where we can get dry, you can have some barrier disruption. And the reason for that is when the retinol starts working, people have this misconception that your skin gets thinner.
Yes.
And the skin does not actually get thinner. When we look at the different layers of the skin, some of them get thinner, but some of them actually get thicker. So the dermis and the collagen can actually start to get thicker. We can build more collagen when we use retinol.
Yeah.
And that's one of the signaling pathways that retinol induces. But because of the way that it helps our skin to mature, the stratum corneum, the very top layer of our skin, the dead skin cells, that layer can actually become thinner.
Right.
And that is where we have some barrier disruption sometimes, because that's where you have dead skin cells like the bricks, and the proteins, the lipids, the ceramides are your barrier. But if that area gets thinner, you can have more water loss through the skin.
Sure.
And also then you have less of the dead skin cell layer for UV rays. They can penetrate through, and you can become more sensitive to the sun.
Right. So one of our main recommendations when using a retinoid is to moisturize.
Yes, and we'll definitely get into that. And I think it's also important to say that not everything that looks like acne, which is the most common reason people use retinoid, not everything that looks like acne is acne.
Totally.
And I've seen many patients who have pimples on their face, and they start using a retinol, and they get a significant reaction because they actually have rosacea.
Right.
And at its core, rosacea has much more compromised skin barrier than acne does, and they get very irritated, they get more red, and it doesn't help solve the problem.
Totally.
So that's kind of a little quick 101 on retinoids, and we're going to give you a little did you know, some tips and tricks about retinol.
All right, let's get into it. So, did you know that retinols and tretinoin has been around since the 1970s?
I knew it's been around for a while.
Yeah, it's been a long time. It's way older than I am.
Me too.
And it was actually kind of an incidental finding. Apparently, they were testing it for something else, realized its benefits, and now we prescribe it every day for acne and anti-aging.
Yeah, I get the impression that the systemic forms of retinol were around a lot longer. They were using them in cancer treatment, and they probably were trying to come up with a topical version for maybe some cancers like cutaneous lymphoma or something.
Sure.
But found that it could work for acne as well. So that is something also for everybody to know, is that the retinols that we use topically are very closely related to isotretinoin or Accutane.
Totally.
And if you are curious about Accutane, love it, hate it, whatever your feelings are about it, we have a whole episode about Accutane.
We do.
And I would encourage the listeners to go back and check out that episode if you haven't listened to it already.
Yeah, and they'll realize that a lot of the side effects of Accutane are the same side effects as tretinoin. You sunburn easier, you get super dry.
Yeah. So, and then retinols, as my little did you know, are also studied for decades now as being one of the most effective topical treatments for anti-aging, fine lines and wrinkles, and can even help with pigmentation.
I believe it. I'm sure we've been trying to prevent aging for a long time as a human species.
Since the time of Cleopatra, probably.
Yeah. So it wouldn't surprise me that they've been using this for
And that's the main reason that I use it nowadays, is I don't get a lot of acne, but I use retinol almost every night because I'm trying to delay the signs of aging on my skin.
I'm in the same boat as you are.
So there's your Did You Know?
Let's imagine you have a patient sitting in front of you who you're recommending to use a retinoid or a retinol, and they've never used it before. What are the best practices? How would you recommend that they use it?
This is the spiel that I give my patients and that I also talk about online, is when you are starting a retinol, you should do it at nighttime. Mm-hmm. Wash your face generally with a gentle hydrating cleanser, and then make sure your skin is totally dry before you put the retinol on. It's well known that applying retinol or retinoids to damp skin will increase the irritation that you get from it, and they will not increase the efficacy. So make sure your skin is dry. Take a pea-sized amount. If you're using a cream or a lotion, a pea-sized amount. If you're using a serum, like we'll talk about later, you're going to use maybe 3 or 4 drops of the serum and then apply that to the face. So you'll dot your forehead, chin, cheeks, and nose, and then rub that in. I generally recommend that if you are brand new to retinol, that you can start using it every other day. And for some people who are really sensitive, using it every 3rd day might be a way to start, because it will take time for your skin to adapt and adjust to this.
Yep.
And then as you build up to daily use, you can also be using a moisturizer afterwards. And there's this concept of the retinol sandwich. Are you familiar with that?
Yeah, I've heard of it. So the retinol sandwich, from what I understand, is you can put moisturizer on, retinol, and then moisturize on top of it. Mm-hmm. Or you can take out the bottom bun, I guess, and just do retinol and then put moisturizer on top. That's to help mitigate some of the dryness and effects from the tretinoin or retinol. I'll often have my patients mix the retinol just with the moisturizer, just dilute it a little bit to allow them to get used to it, and then after a few weeks, do the sandwich.
Yeah. I think that's a good practice, and if you're especially prone to irritation, it's going to help to mitigate some of that. It will dilute the efficacy of the retinol a little bit. Mm-hmm. I don't think it does that too much when you put the retinol on, let it dry, and then moisturize. Yeah. But when you mix it with a moisturizer, or you do moisturizer, retinol, moisturizer, you're going to lose some of the effects, but also you're going to lose some of the irritation. Yeah. And that's important, because my approach to retinol is the more consistently and the more often you can use it, the better results you're going to get.
100%.
So I would rather have somebody use a lower strength retinol, even an over-the-counter one, every day versus using one that they don't tolerate well once a week.
Totally. And I'm in the same boat as you are. When I have my patients or people I know who are using them really infrequently, I remind them you only get the benefits from consistent usage. So if you can use it every day, the one you use every day is probably the best one.
Yeah. How long until we start seeing results from a retinol?
Oh, that's a good question. So it could take up to 8 weeks to start seeing results with tretinoin or that we prescribe, or retinols. 6 to 8 weeks is typically a good average there. And then if you're using it for fine lines and wrinkles, 8+ weeks. So you could take a little bit longer, start seeing the benefits from it. But you'll start noticing changes in your skin within the first month or so. You'll start to notice it looks a little bit brighter. You'll start to notice the dead skin isn't there as much. And sometimes it can help with the hyperpigmentation around the 4 to 8 week mark as well.
And that timeline is largely going to be when you're using it daily. And if you're using it every 3rd day or every other day, it's going to take longer to get those results.
Yes.
So that is something that you should be aware of if you're new to retinol or you're bumping up to a stronger strength. Is the more consistently that you can use it, the faster those results are going to come. Mm-hmm. But it takes 4 to 6 weeks for our skin cells to go from the stem cell layer up to the point where they're shedding off of the skin.
Totally.
So it's at least 4 to 6 weeks before you're going to start seeing anything significant happening.
Right.
But the question that I get a lot and that I see people talk about all the time online is the purge.
The purge.
So is the purge real in your opinion?
I've had patients say they purge with it, but the vast majority don't. Even myself using it, when I was breaking out with acne occasionally, I didn't purge too much, but I do have an occasional patient who says that they purge on tretinoin, and okay, maybe they had a flare, maybe they did purge, but for the most part, I don't see that too often.
Yeah, my hot take is that the purge is overblown, and we just don't see it. And maybe that's because we're educating our patients on how to use it properly, but if you are getting new acne bumps, a lot of those started 2, 3, sometimes 4 weeks earlier.
Right.
Sometimes acne can come up rather quickly. I know that if I eat really poorly over a weekend, that I'm going to get acne that next week.
Yeah.
But most of your acne is already developing with inflammation under the skin, probably before you started a retinol.
Right.
Maybe it brings a little bit to the surface. But this idea that we see on social media of a significant purge where you had mild acne, you started a tretinoin, and now you've got moderate to severe acne, we just don't see it in clinical practice.
Yeah.
And I think what people are largely experiencing as the purge is that their skin is just getting dry. They're getting irritated. They feel stinging and burning because they started at too strong of a retinol or they're using too much of the retinol.
Yeah. Or it's just coincidence.
Yeah.
They're going to have a flare and they started
Acne is
using...
cyclical anyway, and
Yeah.
it may have been, time for them to have a breakout.
Totally.
So, and then other people that should be cautious when using retinol.
So things to be aware of are if you're pregnant, you should not be using retinols because there's the oral version especially is very teratogenic. It can cause birth defects in the baby, and topical versions does get into the bloodstream, but it's mostly unstudied in pregnant people. So we don't recommend that if you're pregnant to use it. People who have sun sensitivities, this will make you more sensitive to the sun, so we need to be careful with that. And people, like you had mentioned earlier, who think they have acne but don't. They have rosacea or periorificial dermatitis or something where you have a barrier dysfunction. This is just going to make it a little bit worse.
100%. On that topic of birth defects and pregnancy, the retinoic acid receptor, as we mentioned, is critical for development. It's doing many other things other than just developing your skin. And so when people take oral forms of retinol, there is a very specific pattern of birth defects that we know that systemic retinoids will cause. And that's why when somebody takes Accutane, they have to have monthly pregnancy tests if they can conceive to make sure that they're not pregnant. They have to be on 2 forms of birth control if they have the ability to conceive. And then there are other forms of retinol that we use for psoriasis or other things, which may have even a longer half-life. They last longer in the body.
Right.
To my knowledge, and if somebody listening knows differently and can send a paper to me, but in all of my research, there has never been a documented case of retinoic teratogenicity from topical use.
Right.
So plenty of people have used tretinoin, even though it's not recommended while they're pregnant, or they use it until they find out they're pregnant, but they've been pregnant for sometimes 3 or 4 weeks. And to my knowledge, there's no case reports of retinoic toxicity to a fetus from using it topically.
Sure.
Now, this may be confounded because many pregnancies are lost very early, and they may have been using tretinoin. And when you lose an embryo at that early stage, you're not seeing this specific pattern of retinoic acid toxicity yet.
Right.
So, but I don't believe there's any published studies saying this person used tretinoin through their pregnancy and their baby had the characteristic birth defects. So, but out of an abundance of caution, we don't recommend it because we know what the mechanism is, and theoretically, if you got enough retinol absorbed through the skin, if you have a compromised skin barrier, then maybe the risk is there. So it's not recommended to use over-the-counter or prescription forms of retinol while you're pregnant. And if we haven't, I don't think we've done a pregnancy skincare episode yet.
I don't think we have.
I think we should do that and talk about what are the things you can use while you're pregnant that are documented to be safe.
Yeah, I think that'd be a good episode. If you've been using a retinol for a while, whether it's over-the-counter or tretinoin, when would you recommend that you go up on the strength? Let's say you're using it for cosmetic reasons.
If you are using something and you see that it's giving you good results, you really like it, and you're not getting irritated from it, I don't think there's a strong case to be made that you need to bump up to something stronger.
I agree with you.
If you want to try something stronger, just know that you're increasing the risk of irritation. But if you stay well moisturized, you may see better results from that. I think people feel that when they start a new product, they see a lot of results in the early weeks and months, and then they're like, oh, my skin's used to it. It's not working anymore. But the reality is you've gotten to the point that product of what it can do.
Yeah.
And you're maintaining those results. And if you were to stop it, you will start to notice more aging, or maybe the acne will come back. So you get to a plateau, and that doesn't mean that the product's not doing its job.
Right.
But if you're happy with the results that you've seen, you're not having any problems, you don't have to switch. If you're not getting the results that you want, then you may want to switch to another option.
Sure.
If you're not getting the results, especially if you're not having significant irritation, I think there's a strong case to be made to bump up the strength of your retinol.
Yeah, I agree with you. If especially if you're treating a specific condition and you're not getting the results you want, I usually tend to go up on the strength. Most of the time, if someone's coming in for acne, I'll start at a 0.05 tretinoin, and then we go up to the 0.1. And
right.
In terms of cosmetic, yeah, if your skin's not irritated, if you feel like you're getting some benefit from it, I would keep doing it. Do people get used to tretinoin? Does our skin get used to it and now it loses efficacy? Is that something that you see at all?
I don't see that. I don't. Kind of as I mentioned, it's going to reach its point to where that strength of tretinoin is going to do so much. And
right.
If you're still breaking out with acne past that, or you still have pigmentation, fine lines and wrinkles that have not improved to your satisfaction, and you're doing really good sun protection, then go ahead and bump it up. If you're tolerating it well, that's great.
Yeah, I agree.
As we wrap up today, I want to make the audience aware of two different options on retinol. First is we're going to have a link to the Air Skin Store on the podcast show notes for 4 different retinols. These are all available at a discount from 4 different companies. 3 are face retinols. 1 is an eye retinol from Rock. But the main product feature that we want to show today is the Dean Skincare, the line that we carry here in the office. This is the Luna Active-E Treatment Serum. We have a 5X and a 10X. These are over-the-counter all-trans retinol. Mm-hmm. So this is a very potent form of an over-the-counter retinol that's only sold through Treasure Valley Dermatology or on shop.drdustinportela.com or deanskincare.com, which we will have in the podcast show notes. But these are really well formulated. I don't find that they're irritating at all. Our patients have loved them. And if you're looking for a really good over-the-counter retinol in that medical grade skincare, and I know medical grade, it's a buzzword, it's a marketing term, but they are well formulated, well studied, and our patients have been very happy with them. And so we want to make those available to our podcast audience as well. And if you're listening to the podcast on the website, you can use the code podcast15 for a 15% discount on all products from Dean Skincare.
Yeah, I'll say these are very elegant. So a lot of the over-the-counter ones that I've tried, I like the feel of these a little bit better. So
yeah, they're a serum, so 4 drops or so in the palm of the hand is going to be enough to cover the face. Dab it, your finger there, and then treat your forehead, your cheeks, your nose, and your chin. And that wraps us up for our
Perfect.
Retinoids 101. Hopefully everybody learned and is ready to pass the test on retinoids. And until we see you guys next time, I'm Dr. Dustin Portela. You can find me on all social media platforms at drdustinportela.com, Dr. Dustin Portela.
And I'm Austin Lee. You can find me at Austin Lee PAC on Instagram, YouTube, and TikTok.
Leave us a 5-star review wherever you listen to podcasts and share the episode with a friend. We'd love it if you guys screenshotted or took pictures of it, listening to it in your car, tagged us on Instagram. We'd love to repost them. Have a fantastic week.